It is my pleasure to welcome Dr. Vora, an interventional cardiologist and assistant professor at Yale School of Medicine. Today, we'll be discussing his JACC interventions manuscript, reporting the association of physician certification and outcomes among patients undergoing left atrial appendage occlusion. Dr. Vora, thank you so much for taking the time to join us and share your expertise.
Joa, thank you so much for having me. I'm really excited to talk to you about our project.
First, can you give us a brief background, about the topic, the questions that you aim to address, and the population that you studied?
Sure. And so, as you know, left atrial appendage occlusion is an alternative for patients that are not deemed to be good candidates for long-term oral anticoagulation. And in the United States, the majority of these procedures are performed by either electrophysiologists or interventional cardiologists. And the training pathway, at least in the US, is that both of these subspecialties share the majority of their training through internal medicine and general cardiology training, but diverge in the last 1 to 2 years for more procedure-specific training. Now, whether outcomes differ by operator certification is unclear. And so, to that end, we use data from the NCDR LAAO registry to see if there were differences in uh, procedure characteristics, success rates, antithrombotic therapy upon discharge, and outcomes among patients that were treated either by electrophysiologists or by interventional cardiologists.
Perfect. Thank you so much. I think that's a very nice kind of background and I think a very important question that, might affect patient care. Um, Tell us, what did you guys find? Was there a difference between, the results for interventional cardiologists and electrophysiologists?
Yeah. So overall, so just to take a step back, so we started with a population of more than 100,000 patients with the LAO that were treated in the US, and the data were captured in the LAO registry. This is from a period of time from 2020 to 2022. And the reason why we selected that time was that was when the current generation, the Watchman Flex device and the Amulet were both available. The In order to identify physician certification, so this is not directly captured in the registry, but the NPI number and the physician name is captured. And so we cross-link that with the ABIM database to get a sense of what the physician certification was. And then the outcomes of interest included the major adverse events, which included death, cardiac arrest, stroke, bleeding, MI, fusion, device embolization, et cetera, mortality, stroke, and major bleeding. And then we use a robust multivariable model to compare outcomes by operator certification. And so after exclusions, there were a little bit more than 91,000 patients in our final study population. Now, of these, the majority of procedures, almost 60,000, were performed by electrophysiologists, with the remainder performed by interventional cardiologists. When we look at patient characteristics, the patients that were treated by interventional cardiologists were on balance just a little bit sicker. They were a little bit older. The CHA2DS2-VASc score was a little bit higher. The HAS-BLUD score was a little bit higher as well. Importantly, um, about 12% of the patients that were treated by interventional cardiologists were from rural settings, compared with just over 7% of electrophysiology of EP treated patients. So that was, I think, one important distinction. When we look at procedure characteristics, the total procedure time was relatively similar. It was just a little bit shorter for electrophysiologists or for interventional cardiologists, about 5 minutes, 69 minutes versus 74 minutes. Importantly, there were some differences in the guidance method, and so electrophysiologists were much more likely to use intracardiac echo compared with interventional cardiologists. And then when you look at radiation time or total radiation dose, those were tended to be a little bit higher among patients treated by interventional cardiologists than those treated by electrophysiologists. When we look to see what medicines patients were discharged on after the
Mm.
procedure was over, the EPs were more likely to use DOAC-based regimens, so usually a direct oral anticoagulant plus aspirin, whereas the interventional cardiologists were more likely to use antiplatelet-based regimens, whether that be dual antiplatelet therapy or single antiplatelet therapy. Now, when we look at 45-day outcomes, there
Mm.
were some modest differences in the unadjusted patient population, but then when we perform multivariable adjustment, overall, there really were no major differences in terms of major adverse events, mortality, stroke, bleeding, etc., which I think honestly is quite reassuring when we're looking at uh, these patients.
Yeah, 100%. And thank you. I think that was a very nice overview of the population and the results. What do you think should be the takeaway message for the
Yeah,
listeners from this study?
so I think that's a great question. So I think overall, our study demonstrates that percutaneous left atrial appendage occlusion with contemporary devices is very safe. There are very low rates of major procedural complications, irrespective of the operator certification. And I think this really speaks to the robust training that occurs before operators are performing this procedure, right? So that Sky, HRS have very specific guidelines for operator experience in terms of transeptal puncture, et cetera.
Mm.
And so I think that those guidelines are very helpful. There are certainly some interesting procedural characteristics that are different between the two operators, right? And I
Mhm.
think the most pronounced is the differential use of intracardiac echocardiography, which I wonder if that will continue to spread over time, especially as more of these procedures potentially are grouped with atrial fibrillation ablation procedures. But overall, the fact that there are no big differences in terms of outcomes, especially after multivariable adjustment, I think is very reassuring. And that patients and programs can be rest assured that the outcomes generally tend to be very, very good, irrespective of who's doing the procedures. I do think that it's important that both electrophysiologists and interventional cardiologists continue to perform these procedures in the future for a couple of reasons. One, I do think that to some degree they have complementary skill sets. At our institution, for example, for the most part, we like to have an electrophysiologist and an interventional cardiologist scrubbing in on these procedures together. I do think that it also has some implications in terms of access to care, primarily because the interventional cardiologists tend to do more of these procedures in rural populations.
Yeah, completely agree. And thank you so much, Dr. Vora, for joining us today. And we invite everyone to go over the full manuscript published today in JACC Interventions. Thank you so much.
Joe, thanks so much for having me. I really appreciate it.